Did you know that more men wish for a bigger penis than those who wish they were taller? I'm Dr. Emma Blake, urology and men's health expert. And today, we're diving into penile girth enhancement. What works, what doesn't, and what you need to know before considering any treatment. Let's start with something surprising. In a global study of over 26,000 men, 45% said they wanted a larger penis. Only 38% said they'd prefer to be taller. And most of these men? They're already within the normal size range. But they don't feel like they are. In fact, many overestimate what's considered normal. One small study showed that men believed the average flaccid penis length was around 13 centimeters. In reality, it's closer to 8 to 10. Another study found that up to 91% of men think their penis is too short or too thin, even if it's completely average. Let's talk about the emotional side. Some men, about 10 to 15%, experience body dysmorphia, a condition where someone fixates on a perceived flaw. But the majority don't have a disorder. They're just deeply uncomfortable. They may avoid locker rooms. They may avoid sex. Their confidence and self-esteem suffer. So why do men pursue girth enhancement? Confidence, appearance, partner satisfaction, a desire to feel more masculine. For many, it's about more than size. It's about identity and peace of mind. And if you're thinking, women get breast implants, why can't men do something similar? You're not alone. Years ago, I might have said, let's focus on therapy and self-acceptance. And that's still important. But for some men, even after all the emotional work, the distress doesn't go away. And when safe, evidence-based options exist, they deserve to be explored. So let's walk through those options together. Let's start with what doesn't work. Pills, powders, and gummies that claim to increase penis size have no scientific support. None. They're not FDA approved, and many contain undeclared or harmful substances. This industry is expected to hit $600 billion globally, but most of it is built on marketing hype, not medical science. Now, let's look at the methods that have been studied. Vacuum erection devices draw blood into the penis to create a temporary increase in size. They can help with erectile function, but long-term changes in girth? Not supported by research. Penile traction devices use tension to stretch the tissue over time, like braces for your teeth. They've shown some results for increasing length. But for girth? Not effective. Next are injections. Autologous fat injections take fat from areas like the abdomen or thighs and inject it under the penile skin. In some studies, this added about 2.5 centimeters in girth. But complications occurred, like scarring, nodules, and even fat embolism. One man died. Because fat doesn't always survive in highly vascular areas, these results can be unpredictable. Silicone injections were first used in the 70s. But over time, many patients developed severe side effects, like disfigurement, granulomas, and long-term sexual dysfunction. Even newer microdroplet methods haven't shown consistent safety. I don't recommend silicone injections. What about dermal fillers? Hyaluronic acid, the same substance used in lip and facial fillers, has been used in the penis. High-volume injections produce noticeable girth increases, but some men reported reduced sensation and less firm erections. Today, smaller doses are used more frequently. These results aren't permanent. The filler dissolves over time. Another option is Pmama, polymethyl methacrylate. It's non-absorbable and stiffer than hyaluronic acid. Some men saw modest gains in both length and girth, but nearly half developed ridges, lumps, or pain. And removing it, if needed, can lead to deformity or erectile dysfunction. Now let's talk about surgery. Dermal fat grafts from the groin can increase girth. But in one small study, 7 of 11 patients developed complications: pain, swelling, and temporary curvature. Porcine dermal grafts, made from pig tissue, showed similar results, but some men experienced fibrosis, which caused penile shortening. The Pmama implant, a silicone sheath placed under the skin, had promising early results. But as time passed, more patients required revision surgeries. The most extreme option is corporal augmentation phalloplasty. Surgeons graft veins directly onto the erectile chambers. One study showed a slight increase in girth during erections, but 40% of men develop temporary curvature. This is a highly invasive procedure with limited long-term data. So what's the bottom line? There is no gold standard method for penile girth enhancement. Most procedures are still considered experimental. Complications are often underreported. And the long-term safety of many techniques is still unclear. If you're considering any of these treatments, be careful. Do your research. Ask questions. Talk to an experienced urologist. And always weigh the risks against the potential rewards. Now, before you go, if you're looking for a safe, non-invasive way to support stronger erections, better blood flow, and natural performance, let me tell you about something backed by real science. Pure concentrated watermelon extract. Watermelon is one of nature's richest sources of L-citrulline, a powerful amino acid that boosts nitric oxide levels in your blood vessels. That means stronger circulation, better oxygen delivery, and improved erection quality. Naturally. Clinical research shows that L-citrulline can help support erection hardness, stamina, and sexual satisfaction, without the side effects of pills or procedures. You can find the link to try it in the video description. And remember, your worth is never measured in inches, but your health, your vitality, and your confidence, that's something you can take back, starting today. If this video helped you understand your body a little better, imagine how many others it could help too. Sharing it with a friend, a partner, or even in a group chat could be the start of a life-changing conversation. And if you're looking for more real, research-backed advice on men's health, without the fluff or embarrassment, hit that subscribe button and turn on notifications. We cover everything from performance to hormones to confidence. This is a safe space for smart, honest conversations about your body. Your support helps this community grow. So share, subscribe, and take control of your health today.